Hello and welcome. My name is Dr. Jerome Lisk. I'm a board-certified neurologist in Pasadena, California, and a fellowship-trained Parkinson's and movement disorder specialist. I'm also on the board for the American Heart and Stroke Association for the Western States. Today we're here to talk about the Conference on Aging, the 2010 Conference on Successful Aging, and how you can be successful. Here we have Mr. Sam Thomas. Can you introduce yourself and tell us a little bit about yourself?
I'm Sam Thomas, and I'm the chairman of the Conference on Aging for the past 5 years, Dr. Lisk, and I'm also involved in the Pasadena Senior Commission as a commissioner, and also I'm on the board of the Pasadena Senior Center, and also the regional volunteer leader with AARP here in the community for Los Angeles. So when I retired a few years ago, I decided to get involved in the community, because I think as we age, if we stay involved, I think we age more successfully, Dr. Lisk.
Okay, and I'd like to introduce our other guest, Mr. Mike Schechter. Pronounce that correct?
Yeah,
okay.
Marvin Schechter.
Marvin Schechter, sorry, Marvin
Yeah.
Schechter. And why don't you introduce yourself and tell us a little bit about yourself as well.
My name is Marvin Schechter. I'm a member of the Executive Council of AARP California, which is the largest organization in the state of California. I'm also chair of the Senior Advocacy Council here in the city of Pasadena, which is a organization that meets at the Pasadena Senior Center. And I'm also a commissioner on the Los Angeles County Commission on Older Adults. I find that one has to be involved at many different levels if one is concerned about the welfare of seniors, at the national level, at the state level, at the local level. One has a role to play if one is a senior concerned about one's own well-being and the well-being of the entire senior community.
Great. Okay, then here we have Dr. Susan Wong. If you can introduce yourself for us, please.
Yes, I'm a board-certified internist and a geriatric physician and a palliative medicine specialist, and I work with Kaiser Permanente Los Angeles, and we have a fellowship program to actually train physicians in end-of-life care.
And very important.
Right, and I first became interested in geriatrics actually in college. I worked in a project where my mentor for the program was in his 70s, and he had very poor vision but was just a vivacious person who really enjoyed life and set that example for me that you could continue that into your older years. And I wanted to be able to pass that on to my patients in my community.
Okay. We have our next guest, Mrs. Mary Winters from About Senior Solutions. Can you tell us a little bit about yourself and the conference?
Yeah, I'm the founder of About Senior Solutions, and what we really try to accomplish within our services is provide quality of life, provide options and solutions for seniors in their aging, and hopefully work on more prevention versus looking at crisis situations that we're solving. But it's a very strong passion as far as aging in place and providing quality of life for individuals at any age. And I've been involved with the Focal Point Consortium in Pasadena, which is also involved in the CNA Awards, trying to better or give recognition to our wonderful providers in skilled nursing facilities, on the board at Central Neighborhood Health Center in LA, and a variety of other locations, because I think it's important to be involved and support our aging community.
Okay. Now, I will be the keynote speaker at the conference, and I'll be talking about how it's important to recognize the signs and symptoms of stroke, and also treatment of stroke, which is important for the aging population. I just met 3 of the 4 guests. I've known Mary for a little while, and all I can say is wow, because if you know, these people will definitely show you how to be successful with aging. And from that point, I'd like to ask Mr. Thomas, what is the conference, and how long has the conference been around?
Well, you know, the Conference on Aging started about 8 years ago, or this will be its 8th year altogether. And the idea was to provide seniors with tools that would help them in the aging process and to help them successfully age. And I think we've done that through a whole series of workshops that are very good and engaged the senior community in. And I'll mention those if you want now, or
Well, yeah. Why don't you mention a few of the workshops and
yeah, you know, we're going to have workshops, of course, on Medicare and Social Security, which means a lot to seniors, and we're also going to have workshops on finding the kind of work you want after 50. Especially seniors in this last year, a lot of them wanted to go back to work. And so we provided some interesting workshops on that. And we have other workshops on brain fitness. We had an expert from UCLA come in last year, and I think she's going to return this year, and she's going to talk about brain fitness, how important that is in the aging process.
Now I understand that you've been able to get seniors employed on jobs that they've wanted through the workshop as well.
Well, yes, I think our conference was successful in helping and guide them, those that wanted to get back into the workforce, and what the steps were. And we've had success with that. Women at Work provided that workshop for our seniors, and I think they're returning this year to provide that workshop.
Yeah, and I think that's very important because that helps with the economy as well. And also, if you as older you get, the more it's important to be active for your health. And the active you are, the healthier you'll be as well. And so, why don't you tell us about some of the medical workshops that are going to be there?
Yeah, a few of my colleagues, Dr. Nancy Gibbs and Dr. Peter Kong, will be speaking at the conference, and their topics will involve fall prevention and fitness activities in the older years. And it's extremely important because we know that if you have a hip fracture, for instance, that mortality rates and functional impairment increase afterwards. So if we can prevent those events, then, you know, again, we can help promote successful aging for an older individual. So we want to help educate about these issues.
And that's important because, as you know, in the healthcare bill that's coming out, prevention is a big key of that.
Right.
So, Mary, what do you feel the community impact of this conference is, and how to help seniors, and why is it important for seniors?
You know, I think we'll have some cutting edge seminars, some of the newest research that's been out. Sam mentioned UCLA attending, Dr. Karen Miller. We know that there are certain things that if an individual does and follows through their life, that they will age well and successfully. So truly, really, any age person should be attending the conference and learning these things as young as possible so that you can age successfully through many decades.
Okay, and I'll also be mentioning about diet and nutrition, which also is something that you want to start earlier than later. And so